everyone, welcome to Easy Nurse, where nursing education made easy. Let's continue with this session, that is Unit 14, First Aid. So next move on to the next topic, that is transportation of injured person. Transportation means, the name itself you can say, you have to transfer the patient. Okay, you given the first aid management. Okay, the first line management you already given. Okay, to save the life of the person, or to reduce the pain, or to reduce the discomfort. But after that, for further treatment, you have to transfer the patient to the hospital so that they can take the medical treatment and they can recover fastly. Okay, so for the transportation, how you will transfer the injured person or injured victim from the place to, from the like a home or any road traffic accident, from that you have to transfer to the hospital. So how you will transfer, that we will discuss in that topics. Okay, so transportation of an injured person to the hospital is a vital step of action. It is necessarily for the healthcare provider who is first aider to check the victim before the transportation. Okay, so when you are transferring the patient from the hospital to the hospital, before that the first aider, the healthcare worker should be see the condition of the victim. Then only they have to transfer the patient. Okay, so what you have to check, whether the victim respiration is normal or not. Okay, you have to check all the vital parameters, like you have to check the BP, pulse rate, respiration, response of the patient, everything you have to check, and any bleeding is there or not, everything you have to check. Then only you have to transfer the patient. Otherwise, before that you have to try to manage the condition. But if bleeding will be there, means you can apply some bandages or cloth to minimize the bleeding. Okay, if parameters are not normal, you have to give the first aid management. Okay, so first we have to check the victim respiration is normal or not, then normal pulse rate, bleeding is there or not, injured part should be well supported and immobilized. Okay, otherwise what will happen, the further it will get deteriorated. Okay, so you should be if any dislocation happen or any fracture happen, you have to immobilize that injured part. Okay, then transportation must be done in a way so that no further injuries occur. Okay, then always keep the victim warm. Those things you have to keep in your mind when you are transporting the injured patients. Okay, next move on to the methods. Okay, methods how you will transport the patient. Okay, under that, first one is manual lifting. Okay, under manual lifting there is a by one first aider, by two first aider. Next one is chair, carry chair. Okay, third one is stretchers. So rescue by air, land and water. So in here they are using the helicopter to rescue the victims, and they can save the life of the victim. Okay, so that they are using the helicopters. Then land, like in land ambulance they are using, motorbikes they are using, water mean they are using the boats. Okay, so we'll discuss one by one. First one is manual lifting by the one first aider. Okay, so this is the first aider, and there is a victim. So in that, human crutch means only the one person is helping the victim to transport. That is a human crutch. Then pick a bag method. So if the person is having any leg injuries, okay, leg fractures or dislocation of the legs, okay, they can walk. So you have to use the pick a bag method. See, you can see them in picture. They are lifting the victim. Okay, the first aider will lifting the victim like a bag method. Okay, it is by one first aider. Next one is manual lift by two first aider. In that, two-handed seat and fore and aft method. So two-handed seat means you can see they are making the two person they are making, the first aider they are making a seat. You can see, and here the victim. So like that they can transfer the patient. Okay, there is a two-handed seat. Then here is a fore and aft method. See, you can see like that they are holding the victim and they are transporting the victim. Next one is carry chair. Carry chair means you can get chair method. The two first aider they are holding the victims through in the chair. That is chair method, and that is wheelchair method. Now mostly they are using wheelchair method in the hospitals, right? And chair method and wheelchair method. Next one is stretchers. Pole and canvas stretchers and trolley cot. You can see this is the pole and canvas stretcher. it is happens, suppose in a road traffic accident, they are transferring the patient from the road to the ambulance. So they are using the cord and canvas stretcher, and in the hospital they are using the trolley cot. Okay. So I hope you all understand about the transportation of the injured person. So let's move on to the next topic, that is respiratory emergency. So let's, under that, first one is choking. So what does mean by choking? So choking is a condition in which foreign particles obstruct the back side of the throat and that produce muscular spasm. It occurs during swelling when food particles goes into the windpipe. You can see this is the universal choking sign, like this they are showing, means any foreign particles, it is stuck in the windpipe and the person is not able to breathe or the person is not able to talk. So when the person is showing like this sign, that means the person have a choking. Okay, any foreign particles is stuck in the windpipe and the person is not able to speak or the person is not able to take breath. Okay, that is universal sign. Understood? Choking is nothing but only when the foreign articles is stuck in the windpipe, you can't able to speak or you can't able to unable to take the breath properly. Okay, that is the universal. This is the universal sign of the choking. So what are the causes of choking? First one is eating food in hurry. When you are getting late. So what you are doing? You are hurry. You are taking the food. Okay, so suddenly the food may get stuck in the windpipe. Okay, that also one causes of choking. Next one is inappropriate chewing of the food. Then speaking while eating. When you are eating food, that time you are speaking with some other person. So suddenly maybe the foreign articles or foreign any items of food, it will be stuck in your windpipe. Okay, so that is the causes of choking. That is when you are eating food in hurry, or you are while you are taking the food, you are talking with other person, or inappropriate chewing of the food. Those are the causes of choking. I hope you all understand about the choking. Choking is nothing but the foreign particles which is get stuck in your windpipe and you are not able to speak. You will show this side. Okay, you will show this side. That means some articles is stuck in your windpipe. Okay, so you are not able to speak. So like that you can show the sign, so other person can understand. Okay, something is happened to you. Okay, and what are the causes? Those are the causes. Next, move on to the signs and symptoms. Okay, what are the signs and symptoms of choking? First one is cyanosis, means bluish discoloration. Okay, then inability to take breath, then inability to speak, then loss of consciousness. Okay, those are the signs and symptoms you may see when the patient have a choking. First they will show like this, then that means that patient is not able to speak and they are not inability to take the breath. Okay, then cyanosis may happen and then loss of consciousness. Okay, so before loss of consciousness you have to give the management. So let's move on to the first aid management for choking. Okay, so if the patient is unconscious, then you have to immediately start with CPR and you have to transfer the patient to the hospital. Or if the patient is conscious, then what you have to do? You can see the picture. Okay, stand behind the person who is choking. So this person is showing the universal sign. That means the victim is this. Okay, so he is showing the universal sign of choking. First, you have to stand behind the person who is choking. Then wrap your arms around the victim waist. Then make a fist with one hand. See the hand, one hand they are keeping in the abdomen of the victim. Okay, so make a fist with one hand. Then keep it slightly above the person's belly buttock, belly bottom and umbilicus. Okay, so in the umbilicus part you have to keep your hand like this. Okay, and in one hand, then other hand you have to grab the fist with other hand and press into the person's abdomen with 5 quick thrust. Like this you have to keep, and you have to give 1, 2, 3, 4 upward direction. Okay, upward direction, inward and upward. Okay, so grab this fist with your other hand and press into the person abdomen with 5 quick thrust. Okay, so repeat those 5 abdominal thrusts until the objects become dislodged or emergency services are not arrived. So this method we can say as a Heimlich maneuver. Heimlich maneuver. Okay, this method we can say abdominal thrust or Heimlich maneuver. We can say Heimlich maneuver also. Okay, so like that you can save the life of the victim. First you have to stand behind the victim, then you have to with one hand you have to make a fist, then other hand you have to make a fist, grab the fist, and you have to press inward and upward. Yeah, like that you have to do 5 times, so that the foreign objects will until the foreign objects will come out. Okay, like that you can save the victim life. That is a universal. That is, this method is called Heimlich maneuver when this for adult person. But for the children's, how you will give the first step when the children get choking. So first is place infant in a lap upside position. So okay, this like this. Then provide 4-5 slaps between the shoulder blade. See, like that you have to place the infant in the lap. Then in a upside down you have to give the 4-5 slap between the shoulder blade. Then if this method fails, then rotate the patient face up on leg. See, this side like this. Okay, if this method is failed, then you have to keep the infant in a rotate manner. Okay, then the face should be up on the leg. Then provide at least 4-5 thrust on the lower breast bone with the help of using one hand only. Okay, only with one hand you have to give the 4-5 thrust. Inspect the infant mouth, anything is there or not. If anything found, try to take out by the hand. Okay, then continue this effort until the medical person arrives. Okay, so like this you can save the life of the children. Okay, so those are the methods you can use for a or first aid management you can use for adult and children. I hope you all understand how to save the life of the victim. So next, under respiratory emergency, the next condition is drowning. So drowning means what? Drowning is a type of suffocation induced by the submersion or immersion of the mouth and nose in a liquid or water. You can see drowning. The person is drowning under the water. Okay. So when they are feeling the suffocations, means they are drowning in the is a type of suffocation induced by the submersion or immersion of the mouth and nose in the liquid and water. Okay, what are the causes? You suddenly fall down in the water. Okay, or children, maybe with the children no one is there, no attendant are there. Okay, they are playing inside. They are playing near the water. So suddenly they may slip and they may fall down in the water. Okay, or any pool or bathtub. The children is alone. No one is attended the children. So by mistakenly the children maybe fall down. Then suicidal attempt. Some person who want to attempt suicide, then they also will do. So children left unattended near water, pool, bathtub, etc. Then suicidal attempt. Next is seizure or heart attack while in water. Those are the causes of drowning. Then what are the signs and symptoms? So signs and symptoms like obstructed airway, shortness of breathing, congestion in the lungs, then fourth come outside and it is around the lips, mouth and nose. Those are the symptoms you can see if the patient is drowning. Then next move on to the first aid management for the drowning. How you manage the drowning patient. Okay, first reach to the victim immediately. You have to reach the victim immediately. If the victim is far, means you have to go and you have to save the life. Okay, you have to reach the victim immediately. Then drag the victim with the help of rope. Okay, so with the help rope, towel, shirt or stick out of, so that you can take out the patient from the water. Okay, you can drag the patient or victim. Then place the victim in a prone position. See, this is the prone position. You have to place the victim in a prone position to drain out the water from the lungs. Okay, you have to give the prone position. Then make the victim stable. If any obstruction is there in the airway, you have to eliminate it immediately. Okay, then start manual breathing. By mouth to mouth also you can give the breathing. Okay, you must be seen in the movies and all, when some person is drowning in the water. So they are first they are taking out, they are dragging the victim, then they are giving the positioning and they are giving the breathing, mouth to mouth breathing they are giving to save the life of the victim. Okay, then arrange the transportation and send the victim to the nearby hospital. Okay, like that you can save the drowning patients. I hope you all understand this session, and with this we have come to the end of this session. In next session we will discuss the further topic. Till then, keep learning and keep exploring with listeners. Thank you.